Hi, Mrs. Beasley. My name is Katie. I'm going to be your physical therapist today. We're just going to do an examination of the wound you have on your foot to try to get an idea of what's going on and how I can help you.
Okay.
So first I'm just going to start with asking you a couple of questions regarding your injury and your overall health. So when did you first notice the wound?
Like 2 weeks ago, I tripped over my rug, and that's when I noticed it.
Okay. Did you notice the wound or did someone tell you about it?
No, I noticed it because I live alone.
Okay.
My husband died.
Do you have any relatives in the area?
No, not really.
How long have you had diabetes?
About 8 years.
Okay. How often do you monitor your blood sugar?
Like normally, and like I think it's around like 90 to 120-ish.
Okay. Are you on any medications to control your diabetes?
Yes.
Do you consistently take those medications?
Yeah, I try, but I forget.
Understandable. Have you ever had a wound like this before?
No, it's crazy.
All right. So while reviewing your chart, I noticed that you were diagnosed with type 2 diabetes, cataracts, hypertension, peripheral neuropathy, osteoarthritis, and suffered a myocardial infarction 2 years ago. Is that correct?
Yes.
You also used to smoke but quit 2 years ago. Is that still correct?
Yes.
Okay. So type 2 diabetes can affect all phases of wound healing. In the inflammatory phase, there is a delay of the fibrin plug, which allows more time for contaminants to enter, increasing the risk for infection. It also delays growth factors and cytokines, which signal the inflammatory cells. In the proliferative phase, diabetes can delay and impair fibroblasts. Hypertension can lead to an increased pressure in the blood vessels, which impairs perfusion and oxygen, meaning the wound may not be getting the nutrients and oxygen it needs to heal. Peripheral neuropathy inhibits the patient's sensation, therefore the patient may not feel the wound when it happened, delaying the time to seek treatment. A myocardial infarction also affects the cardiopulmonary system. If the heart is insufficient in pumping blood, that means the oxygen and nutrients are also not getting to the wound for it to heal. Although she is not smoking now, depending on how long she has been smoking, there could still be some long-lasting effects on her blood vessels. Smoking causes vasoconstriction and increased rate of clot formation. Her BMI out of 30 may also impact her healing because adipose tissue is not perfused well, which impacts granulation tissue formation and puts her at a higher risk of infection. Her cataracts may also inhibit her ability to do feet checks. Okay, so I see that you're on a couple medications, including insulin, metformin, propranolol, Neurontin, and naproxen. Is that correct?
Yes.
Okay, so insulin is to control her diabetes. Metformin is also an anti-diabetic medication. The side effects include stomach pain, nausea or vomiting, and diarrhea. Propranolol is a beta blocker for hypertension. Side effects include dizziness or lightheadedness and may affect the blood supply to hands and feet. Neurontin is a nerve pain medication for peripheral neuropathy. Side effects include clumsiness or unsteadiness, drowsiness, dry mouth, and nausea. And naproxen is an NSAID. Side effects include stomach pain, heartburn, and dizziness. Although Mrs. Beasley does not exercise regularly, she is still somewhat active. She is involved in her church and still goes out but uses a cane, which is good. It is good that she's getting up and moving somewhat. She is also independent in her ADLs, which makes me think she'll be able to care for her wound but may need some assistance from her sons in the area. Her peripheral neuropathy that has caused her balance issues may be a challenge and impact healing. Once the wound has healed, if we can work on her balance and get her more active while controlling her diabetes, she'll be in a better place regarding healing. All right, so now we're just gonna do a quick systems review. Her blood pressure should be normal because it's controlled by medication. Her heart rate should be normal or maybe a little lower due to her beta blocker. Now I check her dorsalis pedis pulse. I'm just looking for an abnormal response of absent. If I can't find it, a 0, diminished would be 1+, or pathologically enunciated would be a 3+, and a normal pulse would be a 2+. I also check her ABI. Then Her respiratory rate should be normal as well. Her range of motion is within functional limitations. Strength is within functional limitations bilaterally. For neuromuscular, I would do the monofilament test at a 5.07, 10 GM. So I come to the bottom of her foot, and now I just want you to let me know when you feel me poking you, okay?
Okay. I kind of feel that.
Okay.
A little bit. Feel that a little.
Okay. Just gonna have to close your eyes.
Okay. Yeah, I feel it.
Okay.
Yeah, I feel it.
Okay, so an abnormal response would be if she reports not feeling the monofilament 4 or more times, and a normal would be her reporting that she feels it. Another test I could do is the vibratory perception threshold. It's performed 8 times in the same area, and I would note how many times the patient does not perceive sensation. For gastrointestinal, I would do the MNA or MUST. I would ask her if she's having any stomach pain due to the side effects of her medications. I would want to get her A1C levels and blood sugar levels. And then can you just quickly walk me through what you would eat in a normal day? Want to get a look at what she's eating because of her BMI and diabetes. Is she eating but not getting the nutrients she needs, or eating foods that aren't healthy? So the location of the wound is on the medial aspect of the tip of her left great toe. Then I measure the wound for length. It would be 2.3. And then the width here would be 1.5, which would give an area of 3.45 centimeters squared. So the wound bed appears to be made up of about 90 to 95% slough and 5 to 10% granulation tissue. The wound edges are attached and even. The peri-wound has callus formation around it. The skin of the big toe presents with erythema and is dry. The nail beds are yellow with fungus and raised, and the skin temperature may be decreased on this side. The wound exudate type is seropurulent, and the amount is minimal. So my wound diagnosis would be a Wagner grade 1 neuropathic ulcer. So yes, I would debride this wound. I would debride the slough that is covering 90% of the wound bed and the callus surrounding the wound using selective sharp debridement because this is non-viable tissue. The best dressing option I chose was foam dressing with low-tack tape underneath total contact casting. Also using alginate to absorb moisture because the cast can get really hot and the patient can sweat. The patient will also continue to use their cane to help with ambulation. I chose this dressing because the cast will allow weight bearing to spread over a greater area, control edema, immobilize foot and ankle to decrease shear, as well as enclose the foot to protect it from trauma. The foam will also help decrease any pressure on the wound from the cast. I would explain to the patient the importance of controlling diabetes, maintaining a well-balanced diet, and how that affects her healing capability. She needs to check her feet daily or have someone come and check her feet because of her cataract. She might have a hard time seeing the wound. She should not walk barefoot, even in her house. Make sure she's washing her feet daily, drying between toes and moisturizing. She should trim her nails straight across and file gently. She may also want to see a podiatrist for a foot exam. Even after the wound has healed, Mrs. Beasley may still have some challenges. If she does not get her diabetes under control, it can lead to other wounds developing, and they could be worse than this first one. She will probably need some sort of permanent footwear to widen and deepen her toe box. Because of her peripheral neuropathy, her balance may still be a challenge, which can lead to an increase in falls as well.